Sports injuries are injuries that occur in athletic activities. They can result from acute trauma, or from overuse of a particular body part. Classification: traumatic injuries account for most injuries in contact sports such as ice hockey, association football, rugby league, rugby union, Australian rules football, Gaelic football and American football because of the dynamic and high collision nature of these sports. Collisions with the ground, objects, and other players are common, and unexpected dynamic forces on limbs and joints can cause injury. Traumatic injuries can include contusion or bruise, damage to small blood vessels which causes bleeding within the tissues. Strain, trauma to a muscle due to overstretching and tearing of muscle fibers. Sprain, an injury in a joint, caused by the ligament being stretched beyond its own capacity. Wound, abrasion or puncture of the skin. Bone fracture, head injury, spinal cord injury. In sports medicine, a catastrophic injury is defined as severe trauma to the human head, spine, or brain. Concussions in sport became a major issue in the United States in the 2000s, as evidence connected repeated concussions and subconcussive hits with chronic traumatic encephalopathy and increased suicide risk. CTE is a progressive degenerative disease of the brain found in people with a history of repetitive brain trauma, including symptomatic concussions as well as subconcussive hits to the head that do not cause symptoms. BTE center: it is most pronounced in football, and a related ailment affects boxers, but is also seen in other sports, and in females and adolescents. Overuse and repetitive stress injury problems associated with sports include runner's knee, tennis elbow, tendinosis. Some activities have particular risks. C. Bicycle safety, gun safety, sailing ship accidents, skateboarding safety. Sports medicine. Injuries are a common occurrence in professional sports and most teams have a staff of athletic trainers and close connections to the medical community. Many retain team physicians. Controversy has arisen at times when teams have made decisions that could threaten a player's long-term health for short-term gain. Soft tissue injuries. When soft tissue experiences trauma, the dead and damaged cells release chemicals, which initiate an inflammatory response. Inflammation is characterized by pain, localized swelling, heat, redness and a loss of function. Small blood vessels are damaged and opened up, producing bleeding within the tissue. In the body's normal reaction, a small blood clot is formed in order to stop this bleeding, and from this clot special cells begin the healing process by laying down scar tissue. The inflammatory stage is therefore the first phase of healing. However, too much of an inflammatory response in the early stage can mean that the healing process takes longer and a return to activity is delayed. Sports injury treatments are intended to minimize the inflammatory phase of an injury, so that the overall healing process is accelerated. Intrinsic and extrinsic factors are determinant for the healing process. Prevention. A warm-up program has been founded to decrease injuries in association football. Many athletes will partake in HGH treatment for athletic enhancement as a way to prevent injuries. Risk of injury can be reduced by completing an effective warm-up consisting of a heart raiser to get your pulse up, followed by sport-specific dynamic stretches. Sports-related emotional stress. The pressure to win can cause significant emotional stress for a child. Sadly, many coaches and parents consider winning the most important aspect of sports. Young athletes should be judged on effort, sportsmanship and hard work. They should be rewarded for trying hard and for improving their skills rather than punished or criticized for losing a game or competition. Using proper equipment is key in preventing injury. The NFL is conducting tests with new helmet designs that could reduce the number of head injuries in the league. Doctors believe fatigue can be a contributing factor in sports injuries because it is more difficult for the body to protect itself when fatigued. Stopping an activity at the first sign of fatigue can prevent sports-related injuries. Treatment. Sports injuries can be treated and managed by using the PRICES Dr. ABC, and TOTAPS regimes. PA Euro Protect, RA Euro Rest, IA Euro Ice, CA Euro Compression, EA Euro Elevation, S, Stabilize. DA Euro danger, RA Euro response. A Euro airway, BA Euro breathing, CA Euro circulation. TA Euro talk, OA Euro observe, TA Euro touch, AA Euro active movement, PA Euro passive movement, SA Euro skills test. The primary inflammatory stage typically lasts around 5 days and all treatment during this time is designed to address the cardinal signs of inflammation: a Euro pain, swelling, redness, heat and a loss of function. Compression sportswear is becoming very popular with both professional and amateur athletes. These garments are thought to both reduce the risk of muscle injury and speed up muscle recovery. Although not proven, some professional athletes use hyperbaric chambers to speed healing. Hines Ward of the Steelers sent his personal hyperbaric chamber to his hotel to sleep in, believing it would help heal his sprained medial collateral ligament he suffered in their playoff win against the Ravens. Hines went on to play in Super Bowl XLIII. See also, health issues in athletics, health issues in youth sports, doping in sport, physical injuries in yoga. References. Further reading: Armatas, V1, Kondra, E., Ioannakos, A., Garlas-Aulas, C.H., Balkopoulos, C. Physical Training 2007. January 2007. March 21, 2009, http, EJMASCOM 2007 Pints Tart Garlas-Aulas 0707 HTML. Cluett, Jonathan M.D. Medial collateral ligament treatment. May 29, 2006. April 16, 2009, http, Orthopedics about Compner injury Esmklinger Y2 HTM. Derman, David. Continuum, the magazine of the University of Utah. Spring 1998. March 19, 2009, http, www.alumni Utah EDA Spring 98/Sidelines HTML. Lysart, Michael J. Knee injuries and therapies in competitive athletes. March 20, 2009, http, Beyond Brown Edu BI 108 Group 06 Homepage HTM. Selznick, Harlan. Sports Injuries ESPN. October 4, 2007. External links: videos on prevention and management of sports injuries, NASM.